Good morning. My name is Luke Anderson. I'm a second-year medical student at UAB, which is in Alabama, so the UAB Hearsing School of Medicine. And today I'm going to be talking to you about a project I've been working on, which is trying to evaluate the effectiveness of a multidisciplinary high-risk pregnancy clinic. So a little bit of background on how this started, why this started. So with the whole spectrum of spina bifida and spinal dysraphisms, the most severe of which being myelomeningocele, because of high quality ultrasounds and in utero testing, it's often a prenatal diagnosis. So usually in the first trimester of pregnancy, we know whether or not a myelomeningocele is pregnant. And what we saw early on was that between the time of diagnosis and the actual pregnancy, there was very little contact with the patient, right? They had the regular checkups, but what this led to was a lot of anxiety because as it turns out, when you find out you have a spinal dysraphism in your child, Google's not really your best friend. So a lot of misinformation was getting to the parents. And so we needed more contact points in order to further that education process so that we could alleviate some of that stress and tension. So what came of that was a high-risk pregnancy clinic, or HRPC, and this was a maternal fetal clinic. So this included a high-risk OBGYN, a pediatric neurosurgeon, and other subspecialties depending on the level of the lesion. So things that can happen with your legs and orthopedics. So orthopedics would often be involved, with urinary continency. So we'd often have urology involved. And what this was a multidisciplinary roundtable educational approach. So we were bringing the parents in, educating them on exactly what was happening, what this diagnosis means, what to expect when both the birth was happening, what to expect as far as quality of life afterwards, and make decisions that included things like, do you want to try to pursue an in utero closure or a closure after birth, which was a big conversation that's come up recently since in utero closures have become more common. So the purpose of this study was to retrospectively look back into a cross-sectional study on all of the people who we are still currently following in our multidisciplinary spina bifida clinic. And what we wanted to do was evaluate the perception of usefulness of this clinic. And COVID kind of gave us a nice natural break because the clinic had to stop meeting when COVID began. So that added to the population of people who had not gone through. And so what this looked like was going into our spina bifida clinic, and we would give a survey to birth mothers of children with myelomeningocele. And using a 5-point Likert scale, which is just that scale that we always use for surveys on, how much do you agree with a certain statement, we posed to them certain statements about their preparedness, about their delivery and surgical plans, and the quality of life that they were expecting for their child. And we also collected open comments. So what parts were the most useful? What parts were the least useful, the most anxiety-inducing, things of that nature. And then we compared all of these results, both between the two groups, and there was a handful of questions that were only asked to people who went through the clinic, as they were more clinic specific. So you can read for yourselves in the bottom right, the demographics. It's pretty representative of the population that we see throughout our hospital here in Birmingham. And what we found was in certain areas, specifically being well-informed and prepared for the delivery and for the initial hospital stay, in addition to feeling prepared for that initial period right after birth, the clinic was super effective in bettering their expectations. So hopefully what that also meant was reducing that anxiety of that time, because knowing what you're about to walk into generally makes people feel a lot better. And that's what this clinic aimed to do. In addition, as you can see over on the right-hand side with those graphical results, these were questions that were asked to try to help compare how they felt. So some of the emotions that went along with this. So if we're talking about comparing expectations, which is very important, especially in the surgical world, people who attended the high-risk pregnancy clinics here at UAB, or if they attended a similar clinic elsewhere, because these are semi-common in big level 1 centers, they felt more prepared. They had better expectations that lined up with what they actually went through. In addition, if you look at that second graph below, almost all of the people, the vast majority of individuals who went through this process here at UAB and elsewhere felt that it was very useful. So as they look back and reflect on their time, this was a crucial moment within their process that really helped them out and allowed them to go through this process with a little bit more ease. Obviously, this will never be an easy process for anybody, but this clinic helped to mitigate some of those issues that come along with it. And that bottom point just talks about how having the multidisciplinary approach of having their surgeon, their OBGYN, and other specialties in the same room, able to bounce ideas off one another, explain things from different perspectives, that was very beneficial for them. So the conclusion of this study, and it's still wrapping up and finishing up, but as we look towards our conclusions, it's looking as though the high-risk pregnancy clinic that was put on and hopefully is going to be restarted in its full glory, provides perceived utility to these families and mothers. So all of this work that's going in to get these surgeons in the same room, to get these specialists to sit down together and do this education, is being perceived as very useful. The mothers that go through this, they feel more prepared, they feel better informed, and their expectations more closely align with the reality that they actually experience. So with that, that's a short overview, and I'll take any questions if there are any. Thank you.